Lindsay, and this is Maddie, and we're interviewing Summer Osha from St. Mary's of Detroit Lakes, Minnesota Hospital. EMS.
We have questions to ask her. What does EMT stand for, and what are the job duties of an EMT?
EMT stands for Emergency Medical Technician, and the duties of an EMT are to administer oxygen, help with patient care, help start IVs, get the IV stuff set up for the paramedic so the paramedic can start the IV, and just pretty much do most of the patient care with the paramedic, and then drive into the hospital.
What is the difference between an EMT and a paramedic?
The difference between an EMT and a paramedic is an EMT puts the blood pressure cuff on, puts the heart monitor on, puts the oxygen on, but the paramedic can administer drugs for the patient and do more advanced care.
What type of training do you have to be an EMT?
You have to have a 110-hour course to become an EMT. It has changed now since the registry has changed it. The National Registry has changed it, and I think it's 240 hours now.
How many EMTs are on staff at a time?
There is usually, on our staff, it's usually an EMT and a paramedic, but as of lately it's been 2 paramedics and a paramedic and an EMT, because we always have 2 crews on 24 hours a day, 7 days a week.
What medicines are used most commonly to treat people?
Well, if there's a lot of pain, we use fentanyl, which is pain medicine. We, for allergies and stuff like that, we give epinephrine and Benadryl. We use all kinds of different drugs. There's a ton of different drugs we use.
Okay, and what are the typical equipment you have in your ambulance that you use on a consistent basis?
The one thing that we use consistently on a consistent basis is the heart monitor and the pulse oximeter. Because our heart monitor is supplied with the leads for the 12-lead EKG, which reads the heart rhythm, and then we have a blood pressure on there too, along with the pulse oximetry, which measures the oxygen in your blood.
Okay. Can you describe a typical dispatch call?
Our typical dispatch call is our dispatch will call up and say, we have a medical cardiac at 1227 Washington Avenue in Detroit Lakes. And they'll either give us if the patient's breathing, not breathing, and what happens, and then we get in the truck and we have 8 minutes to respond to the call from the time we get the call, and we let them know that we're 10-8 after 8 minutes, and we're usually there within 3 or 4.
Okay, and then what are some job hazards and job precautions?
Some job hazards are some of the calls that we've gone on. We're not quite sure what it is. Like there's one call that I wasn't on, but some of my coworkers were. They got called for a cardiac arrest, not a cardiac arrest, a chest pain. And they thought, oh, well, we can just walk into the house. Well, when they walked in, there was a guy sitting there with a gun to his chest. And they're like, oh. So they just backed up and walked out. He didn't see them because we can't go in to a situation like that without the cops there. So they just backed out, the cops came in, and then they entered again.
Okay, what was the worst case you have ever seen?
The worst case I have ever seen was a SUV versus semi on Highway 59 and County Road 6, south of Detroit Lakes. And the lady, supposedly from what we've heard, she bent over, didn't see the semi, and the semi drove over the top of her vehicle. And I've never seen so many wires in my life out of an SUV. And she was driving, she was the only one in the car, but her body went out the passenger side of the vehicle. And she was dismembered.
What is the most rewarding case you have ever seen?
The most rewarding case I've ever seen, well, we had a transfer to Fargo, and the medic I was working with, the guy was chest pain, complete bad case. And all of a sudden, the medic yelled at me and said, "Summer, code!" And I pulled over in Lake Park, and by the time I got back there and we were doing CPR a couple of times before anybody got there, we had the guy back and breathing.
What is the best case you have ever seen?
The best case I've ever seen is just that when people are alive and we get there and they're joking around and it's good. That's good.
What is the usual case you see? So what's the most common?
The most common is usually cardiac, diabetic cases are the most common.
And then how often are your performance reviews conducted?
Every year.
Process?
Every year we get performance reviews, and they go really good. Our boss does them.
Just review them.
Yep.
Okay, that's all of our questions. Thank you.
Thanks.
You're welcome.